so again, you would go through all the normal process of explaining the procedures to the patient, checking your identifiers, doing all that, but we would want to put our oxygen on. You should have an oxygen chamber here. You would want to, again, increase oxygenation on it just a little bit, maybe 1 liter, to kind of just provide that additional oxygen that your patient needs as you're beginning to set up your procedure. Green is always oxygen, yellow is always just air. Sometimes when we're doing breathing treatments, we don't want to do it with oxygen, so we do it with just air. So there would be another little device there for just air. My tubing, this is my suction device. I should have a knob here that I can turn it to intermediate suction, low and high. So I would want it just on low. Then I would test my equipment just to make sure that I do have suctioning, and I would set that close here to the bed with the patient. I would do hand hygiene. And I would want to look at my bottle of saline, and I would want to make sure that it's not expired, and I would also want to make sure that when was it open. If it's been over 24 hours, then I would need to change that out. Then my kit does not have a drape, so I may want to drape my patient just to keep from getting anything on my patient. Okay, and I would go ahead, the kits open. I've done hand hygiene. Little tab on the corners, that little part. Oh, no. Open my kit. And I can discard that. And when I open it, on the outside of here is where you're going to find your little box. And so you want to take it and you want to open it without touching the inside. And then you want to take your saline. And you just need to practice. I mean, when you're practicing, you can just tell me this. You don't actually have to do it. But you would unscrew it. Okay, and then we would just pour off a little bit just to clean the tip. And then I would take it over here and I would pour it into my cup.
You just pour it straight into the trash can? That's first fit?
And then I want to move this over here on my way a little bit. And then I want to open my kit. Inside here are your sterile gloves. I can't see. And my first glove I'm going to pick up from the cuff, remember? And these are a little bit different than the ones that you did with in the package, so you just need to look to see where your thumb is. This thumb is stuck up here. And the second one, maybe underneath it. And this is where you need to be really watching each other closely to see if they contaminate. Okay, and then I can do here. So then I take this and I just kind of gauge from here to here. And so I'm going to say about there's the length that I want to insert. And so then now I'm going to contaminate this hand. Okay, so this now hand is going to be contaminated. She didn't do that on the video. She didn't tell you that, but so this now is my contaminated hand. I want to make sure that I don't touch that. Okay, so I want to test it to make sure. Okay, and since this hand now is contaminated, I can touch things. So now I can take the oxygen off of my patient. Okay, I'm going to come over here, and I just use water to lubricate mine, so you can test it. Okay, or if you wanted to open the Vaseline, you could have, but we're just going to use water to lubricate. Okay, and so then you encourage her to breathe, and and then hold her breath, and then as you go in, on the way out, you want to suction no longer than 10 section. Okay, and then I want to put her mask back on her. My hand is lovely.
Hopefully she can.
Not wanting to do it. Okay.
There you go.
There you go. All right. No, let me come back with me. Okay. And so then I give her 1 minute to breathe. Okay. Clear my tubing. Let 1 minute pass. And then remove. And the whole time I'm monitoring my oxygen saturation, which we don't have pulse ox to put on. Okay. Have her cough. Then when she's coming out, she can cough if she needs to and turn. No more. A lot of times they'll recommend that if you will hold your breath while you're suctioning, it kind of lets you know how long they're going without suctioning.
Mm-hmm.
Okay. Then clear your eye. And then go ahead. Okay. You can wand this up in your hand. Disconnect it. Turn your suctioning off. And dispose of your supplies.